All right, good morning, everybody. Welcome to early sessions at HIMSS. As I said, my name is Matt Turner. I'm the VP of Product Development in our Data Solutions Group at Change Healthcare, building our data science as a service offering proudly powered by AWS. So we're going to tell you a little bit about that today. So if you've been to HIMSS before, you've heard this story, that social determinants of health are a big deal and they matter, and that 80% of the live life experience of individuals happens outside the doctor's office. Unfortunately, this continues to be true, and we're not doing that much about it to really resolve the issue. So in order to better understand the situation, to better bring data to solve these problems, we've introduced an SDoH solution that we call our multidimensional patient journey. The multidimensional patient journey is the live life experience of the individual. So it's not enough just to have the clinical data. Clinical data is episodic. It's self-selective, where a full live life dimension, your economic stability, the access you have to internet, transportation, nutrition, all of these things, they greatly matter. And for us, it's bringing all of those things together that we think is going to produce a superior insight. And we're going to show you a few examples of how we were able to use that. So I'm proud to say that DSaaS has made an impact. So in the COVID-19 pandemic, one of the greatest challenges of our lives, that this data was immediately put into action. So as researchers were moving quickly, trying to understand the evidence, we were able to partner with a number of health systems who have researchers who jumped into our DSaaS platform, begin studying our multidimensional patient journeys to generate new evidence. Our data updates daily, and those daily updates gave them the time to look at new therapies, to look at trends. We're very proud of the work that we've done with Carnegie Mellon and their COVIDcast solution, and we're going to talk about some other partners today. So very excited to be on the front lines of taking this data and putting it into action to make a difference. I want to talk a little bit about our friends at Duke. So a special shout out to our friends, Dr. Michael Pensina and Lane Thomas, who are part of the Duke School of Medicine. Also very involved with DCRI. Got some Duke friends that are here. And these researchers are experts in real-world evidence generation, in looking at the effectiveness of therapies and treatments. And so we partnered very early on to get our data into their hands, so that these experts could analyze early treatment patterns, but more importantly, to look at the social determinants and how they impact things. So I think we know from the data around COVID, it has disproportionately impacted people of color. It has disproportionately impacted those who can least afford that opportunity. So your economic stability, your access to healthcare services were indicative of the treatment and sometimes even the morbidity of COVID-19. And so the Duke folks were able to bring all of this together and to study what do these factors mean. So those folks who are on the higher end of economic stability, can they access healthcare and treatments that would make a difference? What is the effectiveness of early interventions? So all of this has been happening, and we're really proud of the results. The Duke folks were able to estimate that we sped up research for real-world evidence by 75%. And that's a really big number, but what it means is that the typical real-world evidence study takes sometimes weeks and months just to put together the data. And so by giving them a timely access to this, we're able to speed that up, give them over 140 million de-identified patient journeys that they could build these algorithms over and test the effectiveness at scale across the entire country. So that's where our multidimensional patient journey can really shine, by bringing all those things together. These are just a few other examples of the work that we've done. It's been truly humbling to come together with some of the best experts in public health, to look at areas around health disparities. I grew up in Eastern Kentucky in Appalachia, and so to be a public health student, to see it at this scale, this opportunity, these partners stepping in to make a difference, it's really been an amazing experience here. And I think it makes an example of when we have good open data that can be used to make decisions, the research community gets to step up and really shine. So let's talk a little bit more about our data science as a service offering. DSaaS is the platform that sits behind all of this research that powers the multidimensional patient journey. It pulls all of these data sets together daily, so all of our data comes directly from our systems. If you look at some of the challenges that healthcare is facing, so access to quality data for real-world evidence studies. If you look at the detailed compliance requirements around healthcare data, it's not easy to do. The ability to take granular data at an individual level, particularly for the social determinants, is not something this industry's been able to do very well. And although we have data proliferating everywhere, most of it has not been curated or set up to really make us successful. So we are data rich, we are insight poor still, and we're trying to make a difference there. So whether it's taking our data into clinical research, real world evidence generation, a number of different use cases that we can use this for, this clear signal, this longitudinal multidimensional patient journey is impacting a number of areas across the healthcare ecosystem to make it better. Change Healthcare sits in the middle of the industry. We're a healthcare technology company powered by a platform, partnered with AWS, who brings all of this together and allows us to take the data that we have from our clinical networks and put it into action. To go a little bit deeper on our product, we really talk about three major features. We talk about the data, the compliance, and the technology. The technology is proudly brought to you by our friends here at Amazon, so we thank them for hosting us. AWS Health has been an enormous partner for us, helped us to build this solution in record time. But for us, it's the data and the compliance where this gets really tricky. For us, the data is the star. It comes from our network, it's set up, it's made easy to use, but it's also that compliance layer that kicks in. Our always-on compliance engine makes sure that all of this work is done with all the sensitivities around confidentiality, privacy, and ethical use. For those who don't know that much about Change Healthcare, the richness of our data comes from these networks. So we have one of the largest healthcare financial and administrative networks in the US. Tens of billions of healthcare events put together, diagnoses, medical procedures, prescriptions, all of this in a rich de-identified layer to make predictions, create new insights. We also bring in novel data sources such as the social determinants of health. And we have the ability to integrate the customer's own data. So in the case of researchers who have something that they want to study, they're able to bring in their data, jointly tokenize that, bring it into one environment where they can do their studies. It's that comprehensive, multidimensional patient view that we think makes the difference. So let's go a little bit deeper on our product. If you look on the left-hand side here, our data library is all of these data assets that are brought together. We bind these together with identity resolution, a common patient token that we leak across the environment, and then we protect that with our always-on compliance engine. The compliance has all of the governance rules, the policy-based approach baked into DSaaS. We also have the ability to author custom rules to ensure that governance requirements for each customer are considered. So if the compliance officer at the organization wants to build in certain controls around the use of data, we can author that in a very simple rules environment, build that in, and show accounting and auditing across the entire environment. And we think that makes the protection and the use of this data, which is the number one thing that we look at when we get started. Each DSaaS instance is built for a particular customer and their use case. So think of it as a private data lake that has been curated just for that experience. We bring in a rich set of tools from Amazon to deploy notebooks, train AI models, build new insights and analytical applications, all of this in one convenient managed package. Once you've actually built your insight, you can take it and deploy it as an API. And so we build all of this as an end-to-end service. DSaaS really is data science as a service, and that includes the expert determination for HIPAA, the certification and compliance of any type of predictive model, and we work with our customers to deploy that right back into their operational workflows. Thanks to our friends at Amazon, this is some of what's going on behind the scenes. So we're really proud of using tools like AppStream to secure the environment. Obviously, we're doing all of our data lake storage in tools like S3 and Athena. We're bringing in computing resources from SageMaker and EMR and all of these tools to make a really slick experience for the organization who wants to do this. Most of your data scientists are working in R or Python. All of those are natively supported in a SageMaker environment, directly connected to our data, which is always on. Talk a little bit more about our compliance. So, compliance challenges around the use of data, any type of data, data governance has always been a challenge for the industry. We seek to move beyond that by instantiating those directly into our product, by taking those rules, by taking those policies and making them actionable. So whether we're looking for competitively sensitive information, equitable use, looking for potential spots of bias in models, all of these things are things that we bake deeply into our product and have built new capabilities that run on DSaaS and run directly on our data to make sure that we have persistent and always on compliance through every single use case that we do. And finally, as we're starting to wrap up here, what connects with me, what makes this data important, is that these externalities in healthcare are still not being addressed. We have macro level challenges with the social determinants of health. We have communities, census tracts, zip codes, where things are really, really tough. But that does not tell the whole story. So our social determinants of health is focused on an individual level, generating individual insights for that real live life experience of that person in a way that can be actionable, that we can work with them to close those gaps both at that person level and at that community level. So addressing both the micro and the macro challenges, absolutely essential to what we do. We need to have these insights in all of our workflows, all of our applications. If we're not addressing the social determinants of health, we're not going to close the health disparities and the health equity gaps. It's just never going to happen. And so for all the discussions that we've had at these conferences, for all the presentations that you're going to hear this week, I want you to really think about how you can take these data assets, embed them into your workflows, embed them into your planning considerations, into your individual patient care conversations. That's where we're really going to move forward. So just to wrap up, again, thank you to the fine folks at Duke and our other research partners who have jumped in, have been early adopters of our tools, our platform, and our data, generating considerable insights for the COVID-19 pandemic. Really proud of the work that we're doing. We've seen publication from a number of our Data for Good customers, and that initiative has just taught us so much about the industry and allowed us to be a participant in the public health. That Amazon Web Services has really stepped up. They've been our preferred cloud provider, and they have helped us to imagine a better healthcare system. They share our passion for making that a difference. We've been part of the Amazon Health launch, very proud to be part of that. We're engaged with their partner network. We're using their marketplace as a go-to-market channel. All of those things has allowed us to move faster, scale with their technology, and we thank them very much for having us here today. We really appreciate the time. Thank you.